Hello, everyone. This is Jeanine Gangeness. I'm with the Rochester branch campus in Rochester for Winona State, and I just am honored today to be able to visit with Amber and Susan. Amber is a faculty member, and Susan is with the Rochester Public Library. And Amber, I'd like you to just introduce yourself and talk a little bit about your role.
All right. Hi. Thank you. I am Amber Fiedler. I am a professor at Winona State University-Rochester. Currently, I'm the coordinator of all community and mental health practicum experiences that our senior nursing students have. I help to make sure that they have a well-balanced experience out in the community. And as we all know, there is quite a bit of mental health exposure out in the community. So I feel like this is the perfect role for myself. I feel like one of the most beneficial community partners we have is with the Rochester Public Library. Susan Hansen has been amazing when it comes to not only the experience that our students have, but also in connecting me with other community partners. I can't tell you how many people Susan has put me in contact with that now really provide us with a very well-rounded experience. At the Wellness Corner, which I'll probably let Susan expand more upon what the Wellness Corner is, but in the Wellness Corner, our students are there to connect with community members, with people who have any health-related questions. So when the students start out the year, they are told that they will be, quote unquote, manning the Wellness Corner. They will be there to facilitate any health-related questions that a community member comes to ask them. They are very fearful at first. They are scared to death that someone's going to ask them a question that they're not able to answer. And they quickly learn how much more they know than they thought that they knew. They're able to answer questions. They gain confidence very quickly. Another thing that our students gain from working in the Wellness Corner is they learn about community resources. You know, when you think about how most of our nursing students go into the hospitals, to the hospital workforce, they oftentimes don't even recognize what the community resources are that they can encourage their patients to use. The students who have spent time in the Wellness Corner learn quickly about the resources that we have in the Olmsted County and Rochester community, as far as being able to refer them, whether it's for food or shelter or healthcare in general. So they really learn quickly how to refer patients, which I think as a new nurse was something that took me years, how to understand how to actually be able to empower my patients and how to even actually refer them to the next level of care. And I think the most important thing for me, also being a psychosocial mental health nurse, is that our students learn how to build relationships. So they are out in the community meeting many new people, but in the Wellness Corner, there's several populations that learn quickly that our students are there every day, and they come back day after day, week after week, knowing that this is a safe place to just come and talk, to shoot the bull, whatever it is. You know, I think specifically of our homeless population. Our homeless population knows that our nursing students are at Dorothy Day, that they are out at several other venues, and that they're in the Wellness Corner every Tuesday. And so I know many homeless people that specifically come to the Wellness Corner because they know that this is a safe place. This is somebody who cares to carry on a conversation with me. This is someone that knows me. So I think community or relationship building is a huge aspect of what our students get at the Rochester Public Library.
Wow, that's amazing, Amber. Thank you so much for sharing. I think that as I listened to you, I just thought great span of populations that students are able to interact with, really the community as a whole, right? And whether it's someone who's coming into the library just to pick up a book or engage, or it's an individual experiencing homelessness, it's just a great scope and a great opportunity for them to learn about full resources that are happening and available in our community. So thank you for sharing with us what your experience is and all the value you're bringing to our community and to the students at the same time. Susan, can you talk a little bit about who you are, what you do for the Rochester Public Library, and what the value to individuals in our community might be to interact with nursing students?
I'd be happy to. Thanks, Jeanine, and welcome to all those people who are joining the Rochester Public Library branch at my home on Century Valley Drive. My name is Susan Hansen, and I've been a reference librarian at the Public Library since before Al Gore created the internet. In 2013, I was asked to explore bringing experts in their field to the library to meet with our patrons as another way of helping build social equity and health literacy. And so we got a grant from the Blue Cross Foundation of Minnesota to build a special little consult room in the corner of our second floor. And then we started inviting experts in the field, since librarians know where to look for things, but we aren't experts in everything. And we started out with a workforce center and had a career counselor coming in a couple of times a week, and he was quite popular. And so we started approaching other agencies and said, can you bring your expertise to us? Because people like to learn from a person rather than us just handing them a book or article, and often their literacy skills might not be good enough to understand the information in print or on DVD. And so we were thrilled when Winona State Nursing Program wanted to be a partner with us and explore how we could do that. And with our little private room, we were able to schedule the students to come in. And in 2018, they logged 751 hours with us. They saw 918 folks from ages 1 to 93. About twice as many of those were men as women. Unfortunately, with water damage we had last year, we didn't get them in as students in as much as we'd like to, but hopefully when this is all done, we'll have them back for regular things. We build it as a health check or a non-invasive screening opportunity. And some of the things they log what they have done: blood pressure checks, height, weight checks, talk about health issues, check feet, terminal care needs. Should I talk to someone about? And then they give us the type of issue they're dealing with and how serious that is, so that nursing students can encourage them to seek a professional help if they need it. Even questions like, a J pouch is leaking. I had no idea what that was until I had to go look that up. So nursing students provide a real vital service on a variety of health topics. And many of our folks that need services don't know how to access. They're afraid because they don't have health insurance that they can't go to a clinic or the hospital. And so the students are a good way to encourage them that, yes, this is a serious issue, you need to go, or, here's what you should do. We see anybody from all walks of life. I think the students would say we've seen homeless, we've seen some of the upper crust maybe that have come. So we are a safe, neutral space. We are also very centrally located, so people can access us via the Skyway, the bus. It's very easy to get to us. Our staff loves being able to refer to the nursing students because 40% of folks that come to the library are seeking health information. And if they don't know how to use a computer or they don't understand how to use our Dewey Decimal System, they might not always be comfortable asking a librarian. But if they hear the announcement that the students are here or see the poster that the students are here, I think they're more apt to go down to the room and ask their questions. So it's been a very big help for our staff to get the information out there. I love what Amber said about the connecting piece, because that's what one of our roles is as a library, is to help the community make those connections for all kinds, not only our patrons, but for professional staff, because we are involved in lots of different agencies and organizations, and we can help connect folks with what's going on. I just was so excited as a teacher type person that the students get the opportunity to get real world experience and see real world situations. It's a non-clinical space, and they can practice what they've learned. They can continue their education because they may learn some things that they should know that they didn't. They can think on their feet. They can think outside the box. And I love that they're getting familiar with, there's so many resources in our community that folks can access. And I love that they're getting that exposure to that. I think that makes them, even if they end up in a hospital, it gives them so much better of a toolbox to use. So we love the nursing students.
Yeah, thank you, Susan. I really value our partnership with you and the public library. And I just love that our students have the opportunity to really get immersed in the community, and what better place than the public library. So thank you to you, and thank you to Amber for all the work you do to really educate what I call the heroes of the future, right? And so pleased that you could be a part of this. Thank you so much.
Thank you.